How does colectomy treat chronic diverticulitis? Imagine living with ongoing discomfort from repeated flare-ups of diverticulitis. When medications no longer help, doctors may suggest a surgical option called colectomy. This procedure involves removing the part of the colon affected by diverticulitis, usually the sigmoid colon, which is the lower part of the large intestine. By taking out this diseased section, the source of recurring inflammation and infection is eliminated. Chronic diverticulitis happens when small pouches in the colon wall, called diverticula, become inflamed repeatedly. This can cause persistent pain, changes in bowel habits, and sometimes serious complications like abscesses or fistulas. When these symptoms interfere with daily life or when complications develop, surgery becomes a valuable choice. Typically, doctors recommend waiting until after an acute episode has fully resolved, which usually takes about 6 to 8 weeks. This waiting period helps reduce surgical risks such as infection or leakage at the connection point of the remaining colon. During the procedure, the surgeon carefully removes the inflamed segment and reconnects the healthy ends of the colon, a process called an anastomosis. Advances in minimally invasive techniques like laparoscopic colectomy have made recovery easier and faster. These methods involve smaller incisions, leading to less pain, fewer complications, and quicker return to normal activities. However, colectomy is not suitable for everyone. The decision depends on factors like how often and how severe the episodes are, whether there are complications like abscesses or fistulas, and the overall health of the patient. In some cases, if the disease is very severe or if other health issues are present, surgery might be more strongly recommended. It is important to understand that while colectomy can significantly reduce the chances of future diverticulitis attacks, it does carry risks such as bleeding, infection, or the need for a temporary or permanent colostomy. Research shows that the risk of diverticulitis coming back after surgery can be low, but some studies suggest that recurrence rates after conservative treatment can be similar. This means the timing and necessity of surgery should be carefully discussed with a healthcare professional. In summary, colectomy treats chronic diverticulitis by removing the part of the colon that is repeatedly inflamed or infected. This surgical approach offers a potential cure for many patients, especially those with frequent or complicated episodes. It is a carefully considered option, performed with the goal of improving quality of life and reducing future health risks. Always consult a healthcare provider to determine the best course of action tailored to individual needs.